second presentation today. Shirley Yan is an occupational hygienist at the Occupational Health Clinics for Ontario Workers at our Toronto clinic. Shirley received her Master's of Public Health in Occupation and Environment Health from the University of Toronto. She is a certified industrial hygienist and a Canadian registered safety professional. Prior to her work in industrial hygiene, Shirley spent 3 years and is an EHS professional in the private sector. Shirley has a wide range of technical knowledge of industrial hygiene, health, safety, and the environment. Recognizing health and safety hazards, extensive experience with examination and investigation relating to occupational and environmental hazard management and risk assessment. Welcome, Shirley, and today she's going to be speaking about the essential public services, essential workers' health, union-based initiatives to protect mental health of young public transport workers.
Thank you so much, Melissa. Let me just share my screen. Can everyone hear me okay?
Yep.
Yes, okay, great. And the screen looks great?
Yes, the screen looks good.
Okay, thank you so much. Thank you so much for having me here and having me to talk on this very important topic. And it's very exciting for me to share the study that it's a multinational study that we've conducted in the Toronto side with me, Leonora, and Daryl Stevenson. And so it's a great opportunity to share the results from this study, which took about 2 years to complete and involves around 7 countries. And just to give a quick timeline of when this report came out, it's the March of this year, so it's very fresh off the press, and it was conducted by the International Transport Workers Federation, which they released this report on union-based initiative to protect the mental health of young public transport workers. And this report was released along with a briefing paper, and this paper is in 9 languages, so it can be widely accessible. And with it, we have an announcement of an online train-the-trainer course directed to participants with responsibility for youth or occupational safety and health issues within their unions. So with this opportunity, I will be giving a very brief overview of the reports and the lessons we learned from the study, as well as the recommendation for future actions. Okay, so the report showed the experiences during the COVID shutdown of the young public transport workers in 7 countries, and that is Canada, Colombia, Indonesia, the Philippines, Spain, Uganda, and the United States. And the study looked at the impact of these experiences had on their emotional and mental health. It also highlights the action for containment, support, and negotiation that their union implemented. In this multinational study, we also included a scoping review of 30 years of scientific literature of relevance to the topic, plus selected case studies for each country, which I will share later. The research looked into resources available, such as the mental health services provided by employers and measures trade unions have taken to protect young workers' mental health in their capacity, as well as informal support activity young workers have organized themselves in this time of need. The study was designed to bring together existing scientific research with the insights and experiences of unions and their members in different parts of the world, and together to provide recommendation for actions union can take. So in this study, we mostly focused on general mental health and well-being rather than diagnosed mental health conditions. That is, we review studies and ask our study participants questions about symptoms of depression, which are anxiety, burnout, psychological trauma, including post-traumatic stress disorder, substance use, fatigue, and sleeping problem. So this study was conducted during COVID-19 pandemic. So it does describe the impact of pandemic on working conditions and workers' mental health. We also reviewed research and union actions on working conditions and the mental health of public transport workers before COVID-19. Overall, the lesson we learned is that the pandemic did aggravate existing systematic hazardous and stressful working conditions, which affects mental health. And our results and recommendation aim to be useful not only for dealing with the impact of pandemic, but also for union action addressing systemic hazards in public transport work. So prior to the pandemic, through our study, there are studies that's been conducted on mental health in public transport, focusing on urban bus and train drivers. Risk factors that were identified includes the nature of professional driving, so the constant vigilance, the constant exposure or potential exposure to traumas, or the extreme example being passenger suicide, underfunding and excessive demands on workers due to understaffing, long working hours, split shifts, inadequate rest break, tight schedule, lack of bathroom access, job insecurity in most cases for young workers, and outsourcing or privatization of the system. Sometimes that could be a result of underfunding. Another factor is the hostile work culture and social intentions. So that includes harassment and bullying, mental health stigma, lack of respect for the workers, and as well as lack of respect for talking about mental health at workplace, social isolation during pandemic, and conflict between work and family demands. And overall, the design of the bus itself potentially allows vulnerability for the worker to be exposed to assault. And in addition, which is a long-term issue, is the poor ergonomics and the physical hazards such as the noise and the vibration due to the design of the car. And lastly, the overall urban transport system design flaw, which leads to traffic congestions and infrastructure shortcomings. So the studies documented the results, the resulting mental health impact of these risks, which included high level of anxiety, depression, or burnout, psychological trauma from threats, assaults or witnessing suicide, increased risk of stress-related illnesses, including heart disease and stroke, high blood pressure, musculoskeletal disorder, and fatigue or sleeping problems, and the work-related impairments such as a slow response time, divided attention, which themselves exacerbate the work stressor. Another focus of the report was specifically looking into the impact of the pandemic on the mental well-being of young workers and women workers, as they were found to be risk factors. Young workers are more prone to burnout and less able to manage issues such as fatigue, which is likely due to a greater inexperience, and tension between work demands and low rewards. And in the case of women workers, they face specific mental health harms, with greater conflicts between family and work responsibilities, particularly when working longer or more irregular shifts, more severe mental strain from issues such as aggressive passengers, and longer lasting impact from traumatic incidents. So as of August of 2022, 11 research studies had examined the impact of COVID-19 pandemic on the working conditions and health of public transport workers, some of which suggest large impact on mental health. From reviewing larger number of newspaper articles and internet articles, as well as our own focus group and interviews, The results suggest major impact of the pandemic on the mental and physical health of the transport workers and their working conditions. And these impacts include social isolation because of the quarantine with social distancing, anxiety or fear of catching the virus at work, and the risk can be highlighted by coworkers that have contracted the virus or have died of COVID-19. Also including the fear of bringing the virus home to loved ones. The lack of COVID-19 safety equipment, especially early in the pandemic, where protocols were not set up in the timely manner. Intimidation or assaults by passengers, including those caused by dispute over mask requirements, which was often saw by in our interviews. Layoffs, contract terminations, reduced paid work hours, which is compounded with wage reductions, denial of sick leave, and short-term or part-time hiring due to budget cuts, leading to financial strain. On the other side of the impact, they were also increasing workload and increasing work hour because of the layoff, the termination of contract workers. And so that intensified the workload, leading to unrealistic goals and excessive monitoring and fewer work break, and then also the pressure for production. And another factor is the service reduction. So there were fewer buses, and that forced a shift schedule change, and which often change the work location or the route of the public transport worker usually take. And due to worker sick leave or budget cuts, that can lead to more crowding, and more crowding on the bus cause passenger frustration, and then that will create more stress for the bus operator. And lastly, the bullying, intimidation, social exclusions, and lack of respect or compassion from the management that increase the stress level for the workers. So some workers in our focus group and interview pointed out that sources of work stress, such as passenger verbal abuse, assaults, and risk of traffic accident, or management lack of control, certainly existed before the COVID-19 pandemic. However, many did emphasize that the worsening of working conditions due to COVID-19, failure to adequately deal with the hazards of underfunding, hostile work climates, bus design, and the lack of protection for informal workers before COVID-19 may have led to greater mental and physical health impact of the pandemic and lockdowns, especially for informal workers, than otherwise might have occurred had the pandemic did not happen. So the changes that are needed is to the systemic hazards, including informal work and stressful working conditions, to improve the health of workers both during normal times as well as during crises such as the pandemic. Also, the included 7 participating countries, and across the 7 participating countries, the employment conditions, government responses to pandemic varied. However, common finding was that informal workers in public transport appeared to face greater risk to their mental health. A local circumstances such as political conflict can also impact working conditions and mental health. So for example, and there was an economic and social crisis in Colombia, aggravated by the pandemic, led to a large social movement which lasted for more than 4 months. with the road blockage in urban and municipal highways, so causing damage to urban transport infrastructures and excess police force in the control of protest. And in this case, the urban public transport workers were in the crossfire between the police and the protesters, and some workers were physically assaulted. So additionally, participants reported a lack of concern for their own personal safety from transportation companies, which forced them to stay at their workplaces during the riot on several occasions. So shifting back to the young workers, we were able to find only 2 of the research studies looked specifically at young workers, and these 2 studies were both from Taiwan. They found higher level of fatigue or burnout among younger drivers due either to their lack of driving experience or the lower job rewards, such as the lower pay, support, respect, job security, and the promotion opportunities. The very few existing studies of young transport workers was one of the reasons for conducting the current study. While some of our focus group and interview participants reported similar impacts on younger and older workers, others suggested a greater impact on younger transport workers. And here I just want to show you some quotes from the interviews. So here is the one from a young woman bus driver from USA, and she said that I haven't been in the job that long. You have the older operators that have been in the job for 10 plus years, so they have more experience. They know how to deal probably with difficult passengers better than we do that are just starting off. And here is a passage from the young Canadian woman bus drivers who says that I guess some of the older drivers probably choose to retire early when the pandemic started. If you're young, you're probably closer to the start of a career and you're going to try to push through it. And another one from a young Colombian worker. So all unionized workers, indefinite term contract, and it's no use for the company to have us. So they have begun to put disciplinary processes on us for insignificant problems. In the face of slightest problem, they summon us for discharge. So they are, in terms of the responses from the young worker, there are some positive notes as shown here, that the young transport workers have to also take initiative despite the circumstance to create youth organization with the assistance of their union. So this example
Shirley, we lost your audio. The microphone's open.
We lost our audio.
Yeah, our phone is still showing attached with your microphone on, open. Well, guess. Don't know.
Shirley, are you able to write in the chat at all? Just
Maybe we should switch to Krista Lee.
okay. Yeah, we can definitely switch to Krista. Are you ready to kind of go on the fly?
Yes.
Okay, I'll do your introduction here as well. So Krista Lee Hanson is from Uniform. She's an 18-year full-time transit driver on the unceded and ancestral territory of the speaking peoples of the Musqueam, Squamish, and I'm sorry, I meant to ask you how to say this. Oh, perfect. Thank you. And a proud active member of Unifor Local 111. Krista Lee is an elected member at large on the executive of the Unifor BC Regional Council and the elected president of the Unifor Road Transport Council, representing the 24,000 Unifor members coast to coast to coast who move goods or people on the roads. Krista Lee is a member of the 2S LGBTQIA community and a worker with disabilities. Thank you so much, Krista Lee, for joining us today and for adapting on the fly.
No worries. Thank you. Next slide. Thank you. This is just if you weren't sure who we are. So I'm a member of Unifor. We're Canada's largest private sector union, representing 315,000 workers from every sector of the economy. If there is a job you can think of, we have a member that probably does it. This is just a little bit of a breakdown of what we look like. So we do have a lot of manufacturing, but we have hotels and hospitality and healthcare, and I myself am a public transit driver. So that's what we look like as a union. Next. So when COVID happened and we had to seriously look at mental health, we had already been looking at it for a while as a union. But when we really had to look at it hard, we looked at what we already had that existed. So we did have some existing structural supports that we could rely on at our national level, at our regional levels, and at our local levels. So next slide. So we looked to our Constitution. So our Constitution said that we already have certain committees, mandatory, right? So we have a women's committee. We've recently changed the name, I apologize. We have a BIWOC committee, Young Workers Committee, an LGBT community, Workers with Disabilities, Health and Safety Environment, Political Action, and some other committees as determined. So those were put down. We nationally have to have one of these committees. Next slide. And then provincially, we have a provincial structure. We're a national union. We also have to have all these committees, including the Employee Family Assistance Program Committee, right? So we already had a structure there. And then when we look at the next slide, locally, oh, one more. Go to the next one and then we'll come back to this one. I put them in the wrong order. I apologize. So our locals also have all these same committees, right? So we have to have, workers with disabilities and health and safety and employee family assistance and recreation. So we had all these structures already. So we had to figure out how we could rely on and how we could empower them. So as a rank and file worker-led union, the workers are the highest governing authority of our union. We looked at these existing structures already and looked at what we could do, right? And who we could rely on. So each of these committees at all of the levels has kind of taken on what they need, right? It's no good for me to go tell someone what they need. I need to go to them and they need to tell me how I can support them in getting what they need, right? So if we go back one slide, our provincial committee right now, so this is what happened a couple weeks ago for our mental health awareness in May, Mental Health Awareness Week. So our provincial committee in Ontario actually spearheaded this one. So they ordered shirts. These were our 2 online shareables. You can see they're formatted the right size for Facebook and Twitter and all of that. They put out a big letter. If you go to that website, you can see the letter. It actually refers to a lot of resources from OHCOW for our members. And we encouraged all of our members to talk about it because that's been kind of our language for the last 3 years, is talking about it. It's so important that we talk about mental health issues because of all of that stigma that's attached to it. That's kind of always been our tag. So talking about it, we encourage members to send pictures with the shirts, pictures with the shareables. We have pictures of all of our leadership. They were wearing them all week. Lots of locals were wearing them. Got really good uptake on that, just talking about mental health issues, because that's such a huge part of the issue, right? Such a huge part. So if we go forward to the next one, there we go. So because we have all these committees, there's also other things that we can do. So sometimes supporting mental health means letting people do social activities. So this page here are just the upcoming social activities for one single local 444 in Windsor. And if you know anything about unions, there's a lot of old white guys, right? So if you look, we have a golf tournament here, which maybe caters to old white guys in some cases. But if you look, we have a whole bunch of different events that this local is doing, trying to get young workers involved, trying to support them in other things outside of work. Because one of the major issues when we talk about mental health is just that isolation, right? And I know you mentioned it one of you mentioned in your talk earlier that, COVID gave us the gift of time and everything. It didn't give all of us that gift, right? I was considered an essential worker. I got no time off. Many of my coworkers got no time off. So we had the opposite, right? We were completely isolated in our workplace and then often isolated when we came home because we were afraid of getting our families sick. So now that we've opened up a little bit, although the pandemic is not over. I know many people who are testing positive right now. But now that we've opened up a little bit, having different kinds of opportunities to have members to socialize and to break that isolation. So, you look here, we have some family type events. We have cornhole tournament, golf tournament, different types of events. And if we look at the next screen, remember, our members come in all shapes and sizes. So here's some different events that happened, just this week. So the Big Gay Barbecue 3 was a BC Regional Council LGBTQ committee event to promote Ida Hot Day. Today is Ida Hot Day, International Day Against Homophobia, Transphobia, and Biphobia. So it was a great family picnic. We did have a lot of young folks there. I was there. We had a bubble machine, as you can see in the picture. One of our other locals, Local 707, is having a drag event. That's an adult event, but definitely catering to younger folks. Right, so having some of those outside of the workplace things we have found has been really effective when we're talking about, breaking that isolation and, getting people to talk. Another thing that we found really important, next slide, is education. So this really started in COVID. We're big on educating our members. We have language in our collective agreements for, getting money out of employers for education. We have a standalone education center in Ontario. We do a lot of on the road education. So when we were in COVID and we weren't being able to do person-to-person education and we started just doing it all online, we added a 200-minute component to all of our 3-day classes, specifically on mental health. We also created a standalone 1-day class. And now mental health is part of every class we teach. We have a number of 40-hour full week classes, and we're always talking about mental health. And we also develop some standalone materials, including our Mental Health Matters booklet. So if we go to the next slide, and then that's just my cover page for when I'm teaching that mental health one. And we go to the next one. This is what that component is. So when we are talking about that mental health section, we want to open up dialogue about mental health in the workplace. We learn about tools and resources to support our members. We provide some skill building around active listening and making referrals. We review our obligations and responsibilities as reps. Remember, we're union reps, right? And we collectively develop some action plans to scenarios. So we do, like the joke I always make when I'm teaching this, everyone's favorite part, role play. But it really helps, when we have workplace reps that maybe have some stigma about talking about mental health, if you get them to sit down and actually role play those discussions, it makes it a lot easier when that discussion happens in the workplace. So the next slide is, this is just the brief synopsis of that 1-day class that we have. That's a separate standalone that we send out to our membership. It's mandatory for our staff. It goes out to a lot of local leadership. So this is one where we talk about supporting and representing members who are dealing with mental illness or addiction. We learn about the duty to accommodate as it applies to workers, including dependency issues and the rights and duties that apply to the employer, the union, and the individual worker. We are a union, remember, right? So talking about accommodating those workers in the workplace. And this is a huge one for us. We look at where improvements can be made in collective agreement language, right? How can we shift from a culture of fear and avoidance to a culture of empathy and true solidarity in our workplace? As I like to say, if we're not fighting each other, then we have energy left to fight them, right? So it can be uncomfortable in the class, but really valuable class. We've gotten tons of good feedback from it. Something we find really important in our union, right? Just to have that education support. And then the next slide talks about some of those things that we've built. So we do have model language that we've given out. So we have language that says, you know, bargain a mental health rep, right? My local actually we have 6 bargain mental health reps, and that's a worker who's a union rep who the employer pays for a couple days a month of lost time, and they are there just to talk to members, refer members. They have, you know, lots of resources they keep on the property. They go on ongoing training, all of those sorts of things. We have bargaining language around that paid mandatory training, right? The employer pays for it in my workplace, right? That's in our language. And then model language for benefits. This is really important when you're going into collective bargaining, right? And there are so many things in collective agreements that can support mental health that people don't always think of because it doesn't have the word mental health. So when you are talking about sick leave, right? Sick leave can support mental health. You're talking about rehab and recovery, that can support mental health. We're talking about accommodation language, that can support mental health. Harassment language, right? If you're experiencing harassment at work, that can have a very detrimental effect on your mental health. Language about equity, right? If you're a queer worker like I am and you're experiencing, you know, homophobia or transphobia at work and don't feel supported, it's going to have a huge effect on your mental health, right? So just having all of those language things set up so that when our locals go into bargaining, that they have some sort of a framework to work with. That's something that we found is really important when we're supporting workers as well too. And it also, you know, we distribute it. We have a booklet, our Mental Health Matters booklet. We give it out to, you know, members, activists, and they can go to that bargaining committee, which in some cases is made up of those old cis het white guys, and go, hey, you know what? We got some good language on this. I know it doesn't affect you, but it might affect some of us. So just empowering them with that education we found is really important too. And that is my entire slideshow. And the next slide has my email address if anyone would like it. And I'm happy to answer a million questions. So.
Thank you so much, Krista Lee. That's amazing. You guys are doing such great work. I'm actually part of the Windsor area community here, so we often hear a lot of the events that they're doing, and it's good to see they're branching out and including more of the diverse groups that are within the union. Just trying to see if there's any questions here. For some reason, my chat is not showing any. Val, do you see any on your chat? My chat has gone blank.
Yeah. Oh, because you exited and came back, you only see what comes afterwards. So Leonore has a question, but you could also turn your video on.
I'm looking for that, but the button disappeared. It used to be there.
Maybe Tony, did you turn off all the videos for the
I think so.
bandwidth?
It was not working with the video. Mine was cutting in and out as well.
There you go. Okay, we'll try it, and then also Shirley, I'm not sure if you want to
this is the book
start up again, but in the meantime, Leonore has a question. Are there examples on language for protecting, improving mental health at work?
Yes, I know Leonore because we've talked before. I can email what we have. So, I mean, as I mentioned, so many things in a collective agreement can support mental health. So I just have some of the stuff in front of me, but like sick and accident pay, right? Like if you put language about sick and accident pay in, I mean, that helps, right? Cost of treatment, right? Addiction is a mental health issue. It's a disability. If you have language, and personally, this is really important for me and something we're talking about this year for our national bargaining program, is to get language that it's, you know, what's the best for the worker, because the 12-step model is not the best for every worker. And that is often what ends up in employer programs, right? It's not even like in the top 10 most effective ways to, you know, treat addiction. It works great for some people, but it's not a one size fits all, right? So we are working, actually right now, we're in the middle of revamping our bargaining. We have our annual meeting in August and we're on tour. And that's one of the things that has come up, is making sure that we have language that talks about the different kinds of addiction treatment that might be best for members, right? Our language here also talks about specifically about how the language has to make sure that, you know, members aren't punished. right? So if you don't have language, then that can lead to like a punishment approach, right? So having that language gives you that framework to work around, right? So yeah, I will, I think I might even have a link to this that I can find.
I was going to ask you that. You referred to some of your resources in Mental Health Matters resources in the stigma or de-stigma resources. Are those publicly available or only to members?
Well, if you have good Google, they're available to everyone. Here is the that is the announcement that the provincial committee put out that I had that has, you know, all the links to the resources for you folks. And I think it has, let me just see if our link is on the bottom. It's not. So this link that I'm going to send you is not our most recent copy of this booklet, just because it hasn't been reprinted. Oops, that did not work. It
Yeah.
hasn't reprinted, and it has some old leadership information, but it's a good booklet. This is on a local's website. There you go.
Perfect.
So
Thanks.
that's the mental health booklet. That's this, their mental health matters. So that does have that model language in at the back. It's really good.
Thanks.
You're welcome.
Shirley, are you here again?
Can you hear me?
Yes.
Yes.
Okay.
You
I'm so
okay?
sorry.
No
Yes.
worries. It just stopped. Do you want to, is there more that you'd like to share from your presentation?
Well, listening to Krista Lee's presentation, I just have one slide that I would like to share from the study. And yeah, let me just. Are you able to see my screen?
No, it's not sharing yet. You have to choose what you're sharing and then say yes or something like that.
Yes.
It's a two-step process.
Yes. Sorry.
No, it's easily missed.
Can you see it now?
We're seeing your desktop now. Yep, that's good.
Okay.
Put it in slideshow.
Great. Yes.
Great.
Perfect. Yeah, from what Krista Lee just mentioned, and I just want to focus on the recommendation from the whole report and what we want to see going forward and what we learned to that will help, you know, help turn the mental health in a positive direction in the long term and in a more encompassing way. So the first recommendation that came out of the report is the collective bargaining with the employer, and the negotiation should take account of mental health impact, and this is both adverse and positive, with measure to address the underlying issue which gives rise to harm. And depending on the quality of public health care system, the employer should also be persuaded to provide coverage for mental health services, which is what Krista Lee was mentioning. And it's great that we are going in that direction. And the negotiation should consider the particular challenges faced by the young workers and other groups. And the second recommendation is the pressuring government and international bodies. And there was a recommendation for the unions to push for policy measures, funding, and social protections that address underlying issues which give rise to mental health harm, such as poor working conditions and barrier to adequate mental health support. And this effort can be strengthened by building an alliance with, well, in this case, the transport service with passengers and other community groups. So such advocacy should be taken account of the particular mental health and challenges faced by young workers and other groups. Again, reiterate those groups. And the third one is the explicitly recognizing mental health issues and providing appropriate services. And in this case, the union can provide support and treatment directly to workers struggling with mental health challenges, such as peer counseling program, union assistance program, and work to tackle the stigma around discussing mental health. And this work can draw on learning from existing union initiatives around the world and share knowledge on effective practices. But direct service provision by unions is not sustainable substitute for employer and government acting on the root cause of mental health. So we do see the highly importance of involving the employer and the government in pushing this provision forward. And then lastly, of course, engaging with the workers, addressing knowledge gap around the particular challenges faced by groups such as the young workers will definitely help to inform future work on mental health in public transport sectors and support organizing, bargaining, and campaigning service provision. And I do want to take some time just to focus a little bit on the Canadian aspect of this study. And these resources are provided in the chat, I see, so I'm going to move forward. So the Canadian component of the study was led by OHCOW and the University of British Columbia, and the research was due to response to the ITF initiative, and our goal was to pursue one of its key issues and to reinforce the union approach, and which range from individual work experience to the responsibility of government and employer to ensure safe and healthy working environment. And for this, we conducted 6 interviews with 3 key informants from CUPE, ATU in Ontario, and 1 from Unifor in Vancouver. And we interviewed 2 young workers and 1 mental health advocate. And these are the themes identified from the interviews. So for Unifor, which we have Krista Lee here, so before the pandemic, they had mental health advocates in place, so that is amazing. And the Unifor worked to tackle employer measures which had adverse impact on workers dealing with mental health issues. And during the pandemic, each advocate was able to provide additional support, and then illustrating the benefit of having mental health program in place when a crisis arises. So having that program even before, as a proactive approach, and then as Krista Lee already mentioned, that Unifor paid for extra hours as needed, but proposed that yes, the employer should bear this cost in the future. And that is the end of my presentation. And thank you. Sorry for the technical difficulties. Is everyone still there?
Yeah. Melissa, I guess, did you want to?
Sorry, my microphone. I'm having some issues here. I don't know, in and out. Sorry, Shirley, I'm right there with you. Great presentation. And it's nicely how the Unifor falls in line there with everything. And just looking at the chat, I don't think that there are, though I can't see Val. Can you see if there was any other questions that came previously to my entering and exiting?
No, I don't think there's been any added. I do have a few, but people could also put up their hands.
Okay.
We have a few minutes, so or unmute, but we can see if anyone puts up their hand.
Did you want to go ahead then, Val, with your question,
sure.
and then I'll see if anybody puts their hand up.
Sure, and I guess I don't know. I guess it's a question to both Shirley and maybe Leonora and you, Krista Lee, in terms of, were there any I guess from a union perspective and also from the interview perspective, were there any discernible differences across the provinces that might be related to the actual regulatory environment in a province that actually recognizes workplace mental health as a workplace hazard, or versus provinces that are, ignoring that, or only a very narrow definition kind of thing? So any provincial differences that you in your work with the union or in the study perceived or noticed, or that we could build on in terms of, that that there's less stress or more, whatever, anything that you see any differences between provinces?
I don't know. Does Shirley have a good answer?
Sorry, yeah, sorry, that's a great question. In terms of the structure of the unions in Ontario, so the one that we've studied, QP and ATU, it is different in terms of response to the resources for mental health aid. So as I mentioned, the Unifor, which is in Vancouver, has the mental health advocate, which in Ontario there is not. So the form of support is different. I think that's a very vague answer. I'm sorry, but yeah.
And Leonore comments that you guys didn't actually, oh, that's private, sorry. But anyways, that there was no study did not include government policies. I was just more wondering on the reflection of the, that you might see a difference that's a reflection of the government policy or the level of awareness. How about you, Krista Lee? Is there anything that you know from across the country?
Well, one of the big fights, so everything affects mental health, right? So a big fight we had was just getting WorkSafe or workers' comp or whatever to accept that getting COVID was an occupational injury, right? And so that huge mental health issues on people, right? Some provinces did come on board a little faster. Even in my workplace, I think out of, dozens of people that applied, I think we only had a couple that were actually approved that it was a workplace injury because they set the bar pretty high, right? Oh, well, you could have got it at the grocery, you could have got it on the bus going to work, right? I'm at work. I got it at work. I drive a bus with a shower curtain. I get, right? But so, I mean, that was one of the things that I know in some places, like they didn't, right? Like no one got compo for that. So I know that was one of the things that did definitely make a difference. And as far as government regulations on masking, that did definitely make a difference, especially when they were back and forth. And that was a huge issue here in BC too, because we did have, well, at the beginning, we were actually not allowed to wear masks at work by our employer. That could be a disciplinable offense.
Hide your smile.
Yep. Oh, it'll scare the public. But yeah, so eventually, we were allowed, and then it was mandatory. And then we were supposed to say it was mandatory for passengers. But as soon as they decided in BC that it immediately came off the buses and all those signs came off, right? At the same time, I had also gone to Ontario and traveled to Ontario, and it was mandatory on Ontario Transit a lot longer than it was in BC. Like BC, it came down the same day, anything else came down. It was one of the earliest things, right? And it wasn't even that they were saying it was recommended. It was just, nope, no masks, right? So that, of course, elevated stress level. Right?
Yeah, so I can imagine. Well, because it's well recognized that transit workers were significantly impacted around the world, and many fatalities in many jurisdictions, particularly at the beginning before the hazard was recognized and there was no vaccination and no controls or protections. That's legitimately anxiety inducing. So
we did have a fatality in my local. We did have a fatality from COVID early on. Yeah.
That's too bad. We actually had a presentation a few weeks ago about the counting deaths at work. It was on the day of mourning on April 28th. So and transit workers and the risks related it was acknowledged there by Nora Loretto, who's counting cases in workplaces across the country, so that we don't forget and we can learn from that in the future. But I also wanted to ask, I don't know if anyone else has any questions or wants to add anything else, Shirley or Leonore, from a more between countries. I know some of the conclusions of the report talked about, I think, that places where there were unions and bargained solutions or advocates for frontline workers tended to be in better shape than in countries where that wasn't. Go ahead, Leonore, if you want to unmute.
Can you hear me?
Yes.
Okay. Hello, Krista Lee. That's very nice to see you and to see your presentation and also yours, Shirley. Well, I would like to say a couple of things. That one is that I was very impacted by the fact that at the beginning there was an instruction for the workers, for the bus drivers, of not wearing masks when all the passengers were already wearing masks. So that was very shocking, because you could see everybody protecting themselves of a risk when the workers cannot do the same and were very exposed. So that was really very hard, I think, and I think that it put a kind of an inequality on how you deal with different with the citizens just because of their occupation. So I think that was very unfair and very hard. And in regards to the comparisons between countries, one of the things that I remember is that in the case of Vancouver, there was more exposure to violence from passengers, because at that point in Vancouver, there were more people living in the streets that were all across the city, more than in usual times, for saying in a way. So that was increased the risk of violence as well. And the researchers from Colombia were reporting that were more violence due to political issues. So in the case of Canada or Vancouver specifically, were more related to, well, social issues that are underlying, but increased during the COVID. And in the case of Colombia, that was political, but it increases as well the risk of violence for workers. So those are a couple of reflections of what I remember from the interviews and from the report. And really, I recommend the report for everybody, and also, well, the document that Krista Lee is sharing here with us. And well, thank you. That's it for me.
Thanks, Lena. Actually, violence and harassment, well, so my mind turns to the prevention side of things. So the supports and the destigmatizing, that's a form of prevention, right? So people will communicate and then get the help they need, and then we can recognize that things are happening and try to do something. But I'm just, to back up, I guess, from a Unifor perspective or from the study perspective, did we see any, like, I guess, does the union use the ILO checkpoints, for instance, about work for workplaces, stress prevention checkpoints, they're called, the ILO document, or the violence and harassment I would consider to be probably a major risk, particularly in the transportation industry. And I guess, are there, I guess, special initiatives to try and prevent, mitigate harm and that kind of thing, that would, in the long run, also reduce stress and hopefully therefore reduce mental harm and mental injury?
It's such a many-pillared thing, right? Yes. So part of it is adequate, particularly public transit, adequate service levels, right? If you are leaving people behind at bus stops, they're going to take that out on the bus behind you.
Yeah.
Right? you know, adequate training for bus drivers, right? It is, you know, it's a skilled job. All jobs are skilled jobs, right? So we want to make sure that, you know, people know how to deal with the public and, you know how to talk to people and everything else. We are now in an age of physical barriers. I've been driving a bus for 18 years and I was not for most of my career. And we actually just started to get them kind of just before we got into COVID. So we now have those physical preventatives, right? You have a, you know, plexiglass door or whatever you have between you and the passenger, which doesn't actually, you know, eliminate things. It just changes the nature of them. You're not getting punched in the head, you're getting liquids dumped on you now. But anyway, and then there's, so I do live in Vancouver. I do live, you know, I drive through the downtown east side every single day on a bus, and we have some major social problems going on. Like, I've lived here my entire life. The opioid crisis is not being adequately taken care of. We do not have mental health support, right? People talk about, you know, our socialized medicine in Canada, but we don't have socialized mental health care, right? Most people can't afford it. I can only afford it because I have a good bargaining language, because we had good, you know, good recommendations for what to put in collective agreements, right? So we need all, and housing, right? Like, we don't have housing. Housing is just going to completely get out of hand where I live now too, right? Like, people that make what I make as a public transit bus driver can't afford rent, right? So many things that we need to deal with, right? And so Unifor, we are a social justice union, right? We're not just about what's in the collective agreement. And we believe that all issues are workplace issues because all people are workers, right? So it is, you know, lobbying governments for housing and mental health support and those sorts of things, you know, doing work in communities, right? We have groups all across the country that do work in communities, doing work with Indigenous folks. Yeah, it's a lot of work. It's just a lot of work. But yes, ideally, yes, all of this will help the worker, right?
Yeah. Well, it sounds like, yeah, Unifor's doing an amazing job, but there's lots more to be done, right? If only there was more time, more resources, more, and never mind, yeah, the social challenges beyond the workplace that do have a direct impact on the workplace, I think it's kind of a challenge for all of us to go back and consider, I think, in our own workplaces, how people at the frontline staff are impacted by what's going on in the broader world that comes in the door, if it's the door of a bus or the door of an office or to an event that someone's hosting, or so many other ways. So it'll be an ongoing challenge. But I think talking about it and dialoguing about it and sharing the challenges, but sharing some solutions, I think, is the only way forward. And then iteratively, of course, trying to influence things where you can, where you have a point of influence. And the networking and the dialoguing that you showed, some of the social events that the union's doing, that happens on the community level in other places, and how important that is. So it is close to 3 o'clock now. I don't know if anyone else, and Melissa, I don't know if you wanted to add anything else.
Oh, no, you guys had the dialogue. It's just it's great to listen to, and I didn't see any other questions in the chat, just other than Leonora making the comment that mental health advocates were very good resources that Unifor workers had from before the pandemic. Even she just had made that comment. But if Val, you wanted to just speak to Mayday coming up next week, the floor is yours.
Awesome. Thank you so much.
Okay. Was that someone else? Sorry, I just switched over to grab the link again, and then I wanted to say thanks to everybody for attending and participating today, and in our other Mayday presentations. This is the third of 5. The previous 2 weeks are online already. If you missed them, you can watch the videos on Facebook or on our website, on our YouTube channel linked from this website. And then next week is on crisis response, and but it's planning for, it's anticipating the trauma that people involved in crisis response can feel, and then trying to do prevention, or you know, in advance or in the immediate term, that can make a difference. And then the event on the 31st is just additional resources, more information about our survey, Stress Assess, and our partner health and safety associations, resources that they have to support workplaces in across the province. So I guess I usually ask the speakers, so Shirley and Krista Lee, if you have, and Leonore, you're here too, but if you have anything else you just wanted to add at the end, I guess as a final comments on the issue of young workers and mental health supports and prevention for them in workplaces.
I have an easy one. If you folks take the bus, just thank your bus driver. It can make a world of difference to a young worker, especially fresh out of class, who's all worried about everything. Just you know, thank you, bus driver. It's a very Canadian thing, but we actually pay attention and we like it. So
it's a good one. Thanks. Shirley or Leonore, do you have anything you want to add?
I think I'll have the same, just to be kind to young drivers who are inexperienced and they know they're inexperienced. So the stress level just exacerbates by the situation. Mm-hmm.
Yeah, I think everyone's just trying to do their best, right? We need to keep that in mind always.
And that's young workers, like frontline workers in so many industries that have to deal with, it's not just road rage now, it seems to be life rage, or they're just put in challenging situations that they're anxious about dealing with, and then you know they're trying to do a good job, and then they're trying to balance often schoolwork and work and other things going on in their lives. So it's a pretty complex time. Never mind the other issues that we're all worried about now in terms of COVID, in terms of climate change and all that. Leonore, did you have anything else? And then we'll close off for today. No, she says thanks. No. Okay, so we're going to say goodbye, and thanks again, Krista Lee, Shirley, Leonore, Melissa, and hopefully we'll see you all next week, and we'll continue the dialogue and see how we can prevent mental injury in the workplaces of Ontario and across Canada. Thanks, everybody.
Thanks, everyone.
Bye-bye.